Welcome, everyone. This is Aurora Health Alliance's first topical webinar of 2025. Thanks for joining. My name is Jo Glaviano. I'm the program manager for Aurora Health Alliance. So today's topical webinar is focused on food security. We are excited to have you here. So thank you all for being here. I will just give a quick overview of our presenters. We've got Leslie Levine with Arapahoe County Public Health, who will be speaking on the Arapahoe County Food Security Collaborative, and Jaclyn Blitz with Arapahoe County Public Health, talking about the WIC program, also known as a Supplemental Nutrition Program for Women, Infants, and Children, or WIC. And Leslie, I have your slides lined up for you, and thank you so much.
Yeah. Hi, everybody. Good afternoon. Again, I'm Leslie Levine with Arapahoe County Public Health. I'm a senior community health promotion specialist, and I split my time between nutrition and food insecurity policy and tobacco prevention policy. And you can see on this slide, we actually have recently updated our name to make it just a little bit shorter. We're now the Arapahoe Food Security Coalition. And I do want to clarify that although the name indicates that we are a county-wide coalition, we are a small but mighty group. And so for now, we're focused on the west side of the county with intentions of spreading across the county as we increase our capacity. Next slide, please. Great, thank you. So we do have over 100 members in the coalition, representing about 60 organizations. The logos that you see on the slide here are folks who are heavily engaged either on our leadership committee or in one of our task forces. In general, we have hunger relief organizations, we have referral agencies, appointed and elected officials, and residents. In caveat, for the most part, the residents who are engaged are folks who are very passionate about addressing food insecurity. Next slide, please. So here you see our vision and our mission. So we are not doing direct food distribution. Our focus is building capacity of our emergency food providers. So when we were doing strategic planning last summer, what really came to light is we have a lot of small and volunteer-run emergency food providers. And so we really wanted to focus on building their capacity to procure food, store food, distribute food, etc. Great. Next slide, please. So here you see our values, and I want to highlight a couple of things. So first is that we are not actually housed within Arapahoe County government. It was really important to our strategic planning participants that we were owned by the community. So you see that reflected in our values. We also have a lot of folks who are at the table in a paid capacity, but a growing number of residents who are just doing this work voluntarily. So we're trying to figure out how to make participation equitable. And then the value that stands out to me is sustainability. Again, pretty low capacity organization. We don't have full-time or even part-time staff. And so I'm really trying to keep the work very narrow and focused, which we absolutely will expand our scope as we grow in terms of capacity. Next slide, please. So this is some information from the Arapahoe County Community Health Assessment. As you can see, our children are experiencing hunger at the highest rates, just slightly above what we see at the state level. And I'm guessing Jaclyn might have some more data to share. Next slide, please. So as I've mentioned, we did strategic planning last summer. And prior to doing that strategic planning, we implemented a lived experience food insecurity survey, and props to our WIC program. They really pushed out the survey in their waiting room. So we had about 100 respondents, mostly Spanish-speaking WIC participants. And we really wanted to better understand what is their experience with food insecurity. And so here, the question was, how food insecurity is impacting their household. So as you can see at the very top there, people indicated that they experience a lot of worry and anxiety about having enough food to eat. People also indicated that they had a decreased food choices. They also were choosing foods of lower quality, and then unfortunately were also eating less food. Next slide, please. We wanted to know how people are making sure that they have enough food to eat. And as we assumed, many responded that they're using community resource organizations like food pantries. They also indicated that they're eating less expensive and less healthy foods. And then they also let us know that they really rely on friends and family to help them out as well. And one more data slide. Next slide, please. We wanted to hear how often they're using community resource organizations like food pantries. And so on this slide, you can see a little bit more than 60% of respondents indicated that at least once a month, they're using a food pantry or a similar resource. Next slide. Okay, this is a really busy slide, but it actually tells a nice story about where we've been, and then I'll get into where we're going. So, you know, it's one of those things where you go to a meeting for the first time. I was at a Littleton Rotary meeting and just happened to sit down next to some staff from the Graceful Foundation. And that's where they let me know that we really need to increase collaboration among our hunger relief organizations. And so we pulled in some folks to have a very brief conversation to see if people were interested in yet another coalition. And this one focused on food insecurity. So you can imagine what the response was. And so we decided to move forward. I have funding from the state health department to address reducing consumption of sugary beverages and addressing health disparities. And so I was able to allocate some of those funds to hire a strategic planning consultant who led us through the process. Last summer, we created a one-year strategic plan. And then it was during that process that we decided we don't want the coalition housed within county government. So we now are a partner project of the Colorado Nonprofit Development Center. They're our fiscal sponsor. And then in September, we really ramped up our recruitment for the coalition. We launched monthly virtual coalition meetings and task force meetings. And really happy to share that we have between 25 and 35 people per month attending those coalition meetings. Usually what takes place is we have updates from our task forces, and then sometimes we have speakers or we invite our coalition members to share about work that they're doing or request that they have among their, that their coalition members might be able to support them with. In September, we were able to hire a consultant using a rapid response grant from the state health department to create a data dashboard with food insecurity data so that the coalition members have easy access to some food insecurity data at the county level. And then folks were really excited in October to come together in person for the first time for a networking event. Cafe 180 hosted us. It was really hard to get people to sit down and break out into some small discussion groups. And that's where we had some conversation about what's going well and what are some of the needs or some of the pain points that our organizations are experiencing when it comes to food insecurity. And I'll touch on that in a few minutes. Just like with most grants, we were required to do a coalition survey. So in November, we conducted that survey. A little odd since we just launched in September, but it gives us some really good baseline information about how people feel, if their voices are being heard in the coalition, and if they have opportunity for engagement. So we'll do that survey again later this year. In December, the coalition voted in a slate of leadership committee members, and we did their onboarding in January. So it is a mighty committee of 4 people. We have Advent Health at the table, Cafe 180, Backpack Society, and a very passionate resident. And so it's a great group who is helping to guide the work of the coalition. And then earlier this month, we hosted our first training, and we focused that training on the nutrient quality of foods that are being distributed with a focus on nutrition policies. And so One of Jaclyn's colleagues from our WIC program presented about why nutrient-dense foods are so important for the food insecure population. And we had Food Bank of the Rockies talk about some nutrition standards that food pantries could put into place. And then we had one of our coalition members share about a nutrition policy that they have that guides the foods that can be donated and the foods that they distribute. And then lastly, we're in the process of conducting a capacity assessment of our emergency food providers. So we're looking at things like how they're procuring food, where they're storing their food distribution practices. Do they have sustainability within their volunteers? What does their funding look like? Can they keep their doors open for the next 1 or 2 years? And then also their kitchen facilities. So we're really getting an understanding of what's going well and are there some trends among their needs? And I'll touch on that in a minute. Next slide, please. So we do have 6 task forces and we are always recruiting for new task force members. And so these task forces align with the goals within our strategic plan. Some of the things that the task forces are working on. So for example, governance and operations is writing up a job description so that when we get money to hire a coalition director, we'll have that job description ready to go. The data and evaluation group is overseeing the capacity assessment, and they helped out with creating that coalition survey. Our outreach and engagement task force is working on a community engagement plan. We really need to ramp up our membership. We need to bring in some more skill sets to make sure that we can start working on some projects to build capacity. And we also want to make sure that we are recruiting people who have lived experience to be part of this work. Programs and projects, they're the ones who put together that networking event and the training. The fundraising task force is working on a fundraising plan. And then communications task force has been hard at work on a website for the coalition. Next slide, please. All right, we'll go back to that capacity assessment. So I've been able to do 5 of the interviews. I think we've interviewed about 20 of our coalition members so far, and we're hearing some really great things about what's going on to serve our community members who are experiencing food insecurity. So one, it's really nice to hear that they can pick up the phone and they can call a church member or a community resident and say, I need $500 or $1,000 to buy more food. And they're getting positive reactions to those requests. We're also hearing that a lot of our organizations have long-term, very stable volunteers. And then they get really good feedback from their clients about the food that's distributed and thinking about those hot meal programs, the social connections that it allows, especially their older adults. There's a lot of appreciation for that. As you can imagine, some of them jump right into the pain points, and others we have to dig a little bit to get them to talk about the things that are a little bit more of a struggle. I heard consistently that folks are worried about having to turn people away. So obviously demand is increasing, and that's something that they just don't want to have to experience. At the same time, I think individually we're experiencing it. And certainly the hunger relief organizations, that the higher food prices means more and more of their budget is going towards food purchases for those organizations that not only get food donations, but they also have to purchase the food. And then something interesting, remembering that most of the folks being interviewed, their work is centered in the western part of the county, is they have volunteers who are driving across town to Food Bank of the Rockies in their personal cars and pulling them up to the loading dock. So there's some worry. One, it's the time to drive across town, but also, the liability that these volunteers have with their cars potentially getting damaged, pulling up to the loading dock, et cetera. We've heard people request marketing support. If they're running a hot meal program, they want to make sure that every one of those seats is full. So it's just some interesting things that people have indicated that they need help with. And then, as you can imagine, in these conversations, it's not just talking about here's what's working and not working, but some interesting brainstorming has happened. And so these are just ideas, no commitments. There'll be conversation over the summer to prioritize what we want to do. But one of the things that we've talked about is maybe putting together a buying cooperative. So we've got larger operations like Nourish Meals on Wheels and Cafe 180. And then we have the, once a month hot meal program. And, is this something that could help everybody with being able to purchase food? We have no idea how this would work because I don't have an operations background, but what if we could purchase a vehicle, have insurance for that vehicle, an insured driver, and our members could essentially rent that vehicle to do their pickups at Food Bank of the Rockies and alleviate that concerns with their volunteers messing up their cars or their cars getting damaged. And then something that we've heard in the capacity assessment, we heard it during strategic planning, we heard it at the networking event, is we need storage space. So some kind of warehouse facility for shelf-stable refrigerator and frozen food storage space is absolutely something that our members are needing, and have heard murmurings about some kind of commercial kitchen as well. So that is far into the future, but it is top of mind for sure as a need of our members. Next slides, please. So what is coming up? So I talked about more community outreach and engagement, especially with our community members who are experiencing food insecurity now, so that we make sure that we're integrating their lived experience into the direction of our work. We will be launching that website by early to mid-April. And I think this will be really important for our coalition recruitment efforts, as well as our fundraising efforts. Fundraising has been a lot harder than I thought it was going to be. So having that public presence, I think, will be really helpful. Definitely more trainings and networking events. What we are working towards sometime this summer will be a training on fundraising, whether that's grant writing, whether that is building relationships with donors and family foundations. I think people are going to have to get a little bit more creative on fundraising. So that is in the queue, as well as some informal networking events, just to get that relationship building, partnership building among our members. What I hope to do over the summer is to bring together coalition members to really dig into that capacity assessment data and figure out what are our long-term, short-term, mid-term, any term capacity building projects that we can do. What are things that can be done without any money, just with some volunteers? What skill sets do we need to recruit? But I think those short-term capacity building projects are going to be really important to keep our members excited and engaged in the coalition. So excited to see what we come up with over the summer. That fundraising plan, we need staff, we'll need money for some of those projects, and then obviously light operations. So we'll again put together a mix of some small family foundations that have invitation only grant opportunities. Who are the donors in our community? What businesses do sponsorships? I think that will be the future of our fundraising plan. In the meantime, we are going to roll out membership fees so that we do have some funding for light operations, maintaining that website. We use Basecamp as our internal communications platform, things like that. And then lastly, we want to use the community engagement spectrum tool so we can look at what is the depth and breadth of our partnerships with our member organizations. And next slide, please. All right, here is my contact information. Not sure if we'll do questions now or after Jaclyn does her presentation, but would be happy to chat with anyone if you want to learn more about the coalition.
Thank you, Leslie. Appreciate the time and all the work you've put into it. It's exciting seeing the process, and really invigorating to see how much work you've done in really a year. It's been pretty much a year, right?
Yep, lots of great volunteers.
Awesome. Well, thank you. Questions? All right. Well, I will now turn it over to Jaclyn.
Thank you. So I am Jaclyn Blitz, and I'm with Arapahoe County Public Health as well in the WIC program. I've been with WIC for about 14 years. So I was with Tri-County previous to Arapahoe. So just for people who aren't aware, what WIC is, Supplemental Nutrition Program for Women, Infants, and Children. We offer one-on-one tailored nutrition counseling, healthy food, breastfeeding support, and referrals in health and community services. So we have a program called Warm Connections in our office that helps link families with mental health services, but we also refer to kind of any other assistance that we think might be helpful for that family. Next slide. And Arapahoe County WIC, now we're up to over 12,000 participants per month that we're serving through our remote and in-person visits. We have 3 clinics. 2 of them are in, well, 3 of them are in Aurora, being the one co-location with Child Health Clinic, and 1 office in Englewood. So we're on 14th and Chambers in Hamden. And in those offices, we're speaking over 42 languages. I'm imagining many of these organizations are also used to that in the Aurora area. But we've noticed some shifts over the last few years of which languages we're requesting more with our language line services. And more than half of our WIC staff are bilingual in Spanish as well. So that's very helpful. Next slide. So who receives WIC services? It's for pregnant women, infants, and children, as well as breastfeeding women up to a year and postpartum women up to 6 months after they deliver. If a woman experiences a miscarriage, they also are eligible to stay on the program for 6 months to receive food benefits at that point as well. And then children up until their 5th birthday. So we try to remind families when they join, that once the woman is no longer eligible for WIC services, their child can stay on till 5, because we do see a drop off after about 1 year old, less and less participation of the older children. Next slide. And in order to be on WIC, we are an income-based program. So these programs here, Medicaid, SNAP, TANF, and then the Indian Reservation Program would make someone automatically qualify for WIC. So if you have any of these services, you don't need to show any proof of income. We also have a portal that we can look up somebody's Medicaid status if they don't know their number, and if they have Medicaid, makes things very easy. We can automatically get their address, ID, and income right from that Medicaid portal. And then next slide. And if they don't have the any of the programs that would make them automatically eligible, then we do verify their income. And this chart here is our most up-to-date, which does change every year a little bit. We've been increasing, a few dollars each year. But a family of 4 making roughly $1,000 a week would still qualify for the WIC program. And just to take into consideration when we're counting the family size, a pregnant woman does count as 2. And a foster child is just a household size of 1. Foster children are typically on Medicaid, so no matter their foster parents' income, they are automatically still eligible to be on WIC as well. So next slide. And this is just an overview of kind of what happens at the WIC appointment. And again, since COVID and now even into the future, we're offering remote appointments. And I think about 80% of our appointments are remote. It's definitely a preference for our clients. We have in-person options for them at all the clinics. But again, most clients, they can, do WIC on their lunch break, or, it's just a lot easier than lugging their kids around. But that's definitely been a change for us that now we're used to, our staff doing a lot of appointments over the phone. But we'll verify their eligibility with the income, address, and ID. And just in this last year, the state health department has become more lenient on the proof of ID. So that was very, very strict in the past. We couldn't get someone on WIC without proof of ID. And now we can, if they sign an affidavit saying that they don't have an ID, we can enroll them onto the program. So we make sure they're eligible and then obtain measurements, so height, weight, and we do a finger poke for iron. Then there's a questionnaire. It's typically like 15-20 minutes per participant in the family. So each person who's eligible for WIC will have their own nutrition interview. The parents are most likely answering. And then our WIC educators will kind of assess their nutrition risks and go over any other programs they may be eligible for at that point as well. And if they are have a high risk for anything nutrition related, they have a chance to speak to a dietitian either right then, or a dietitian will call them back at another visit. We'll provide their e-WIC card. And again, for those remote appointments, we give them the option to come in same day to pick it up if they want to be able to shop same day, or we can mail them their cards, explaining how to use the groceries. And then the return visit is between 1 and 3 months out, depending on kind of how they're doing. So if we have concerns about a baby, we may want to check in with them in 1 month versus 3 months, but we are able to give up to 3 months of benefits at a time. Twice a year, families are also eligible for it's called wichealth.org, and they can go through on an app and complete some lessons on their phone to get their benefits. And so then they don't need to have an appointment. They just do those lessons online, and then we're able to upload their benefits as well. So really, it's come down to about 2 appointments a year for WIC for kind of typical families. Next slide. And this is a really old picture, but it's still showing a lot of the same foods that we provide. So SNAP is, a federal nutrition program as well that provides a dollar amount per family. And with WIC, we're providing actual amounts of foods. Aside from the fruits and vegetables, that's a dollar amount. And so children are getting $26 a month for fruits and vegetables. Pregnant and postpartum women, $47 a month. Breastfeeding women, $52 a month. And if you're breastfeeding twins, $78 a month of fruits and vegetables. And then the other foods are like 3 gallons of milk, 1 dozen eggs, 12 ounces of whole grains. So the families do need to shop according to like ounces and units for the other items. But what is helpful is with the rising food costs, they're still able to get the same amount of food each month. And, with the eggs, they can buy organic eggs. All of that is still allowable in the food package. And just this year, they're adding canned fish for everyone. That was just for breastfeeding women in the past. Now that's on everybody's food package as well. So every couple of years, they revamp the food packages. And they've recently allowed, which is something we've been asking for years, you can choose to substitute and not get juice and add more money on your fruits and vegetable voucher. And it's pretty cool because a lot of families are opting to go that route and get more fruits and vegetables versus the juice. Okay, next slide. Just a little bit more about the food benefits. So there are over 100,000 participants in Colorado using the WIC program, and the average household value of their package is between $85 to $136 a month. This is just showing kind of in our, how much impact we have in the grocery stores as well, of how much money families are spending in the grocery stores. And there's 450 grocery stores in Colorado that accept WIC. Arapahoe County has, it's very big and lots of stores. So we have one of the highest areas with acceptable grocery stores. So our staff are also going in and kind of making sure that they have all the correct food items on the food package, and that there is enough of each item for families to be able to purchase. Next slide. So another big pillar of WIC is breastfeeding support. All of our staff are trained in breastfeeding, and then we have a few more staff in each office that are more highly trained, and they are certified lactation counselors as well. We have peer counselors available to moms, so we ask them when they enroll if they want to join that program, and then they'll have a number for a real live person that they can text 24 hours a day, 7 days a week with questions. And if they don't text the peer counselor, the peer counselor will text them kind of every few weeks and few days in the beginning just to check in and provide some questions. Are the main grocery stores in North Aurora? So it's interesting because the ones in Aurora are mostly actually in Adams County once you're on that north side of Colfax. So clients can shop there, but those are Adams County stores. We're right now working on this grocery store tour group that we're working with Village Exchange, and we're trying to find a store in Aurora that is in that area, but we're thinking about the Joramucho that just opened near our Altura Plaza, because that one is in Arapahoe County. There is a King Soopers, but again, that one's in Adams County, which is fine for the clients to shop at, but we try to stay in Arapahoe for our projects. And then we have baby feeding classes, and as well, we have a baby cafe at our Aurora South office, which is the one on Hamden and Chambers, every Tuesday. That's led by some of our breastfeeding experts, and moms can come in with their babies. We have had such great success of people just coming every week and getting good community and support. You don't need to be on WIC to attend the baby cafe. So that's open to anybody. We have snacks, and there's like a theme each week for people to learn more information as well. Next slide. So this is a little bit more about, getting results from WIC and why the program has been around for about 50 years, super successful in helping increase our nutrition in that vulnerable population. I did want to back up when I was talking about the foods before, just in case people are interested. After formula, we also provide at WIC, that's worth a lot of money. And after formula, the most utilized food on WIC is the fruits and vegetables, followed by eggs, berries, and cherries are the top in the fruit category. So it's pretty cool that people are using their WIC benefits and getting some of that fresh food. We look at it's called their audit trail, so we can see what they've purchased and sometimes base our counseling on that as well. So if they didn't use some of the items, we might chat with them and just ask if they know how, or they might not know how to prepare the foods. And so the foods itself has become like a way for us to increase our nutrition counseling. But yeah, next slide. And then this is just kind of showing that increase in how much food has risen over the last few years. And I actually thought it was going to be a little bit more extreme than this, but I think partially because some of the foods that are on WIC maybe haven't been as hit as other foods. But they have gone up from 2023, 2024, 2025. So the average that each house is getting for their WIC food package. And then this is kind of just the impact on the grocery stores in Arapahoe County and how much money that the WIC program is putting back into those grocery stores and how that has increased as well. Next slide. And our participation, so this is our caseload. It's right now, this was January 2025, and we've actually gone up steadily even since then. And we're not really sure how we're doing that because we haven't been able to increase our staff in over 2 years. So we've gotten very creative in forming some more nutrition classes to get more people in at the same time. With that wicchealth.org that I was talking about, that they can do the class on their phone. That's kind of really increased our efficiencies as well to get more families seen. But our caseload was, around 10,000 when we became Arapahoe County from Tri-County, and we've steadily increased. It has been increasing in the state of Colorado as well. But I'm sure we can talk about it in a few minutes too, just if you've had experience with clients who are trying to get on WIC and kind of the challenges of getting an appointment is just the high need and our inability to hire more staff currently. So yeah, so enrollment backlog, exactly. So right now, the way that we schedule for the 2 Aurora offices are, we save about 2 or 3 full staff members appointment day for next day appointments. So families call at 8 a.m., they get an appointment for the next day. Those are full by 9 a.m. easily, 8:30 sometimes they're already full. Then when people call after that and we're already full, we'll offer them to schedule further out, or they can call back again the next day if they want a sooner appointment. And right now, our further out appointments are about 4 to 5 weeks from now is when they can get into the program. So I think it's honestly messaging about, we're trying to do the best that we can and help as many families as we can. And I think the other main thing is, like, if you have an appointment, like, keep your appointment and don't miss your appointment, because it will be really hard to get another one. We do send reminder texts as well. So the families will get a text message the day before their appointment, reminding them of that appointment as well. If someone's scheduled for in-person or remote and they show up in person, or they don't show up, we can do it remote. We can flip-flop, like, that's no problem as well. So just to let you know that as well. And I think it's challenging. Like, our reception staff are definitely stressed out trying to help as many people as they can, because they hear, how upsetting it is if someone can't get in right away. And there has been a lot of kind of calling other WIC from Denver, and we haven't had as many go up to Adams County, but a lot of kind of Denver, Arapahoe going back and forth, just trying to get in as soon as possible. Because for a while, Denver was scheduling 3 months out and we were scheduling about a month out. So, there was a lot of back and forth movement, but I think just, if someone's been on the program, we can also, if they're not brand new, we can usually issue them 1 month of benefits, get them to that next appointment, and then see them to get their 3 appointments. If they've never been on WIC before, that's when they, do need that full appointment. But if it's someone who's been on WIC and is currently part of our program, we can usually issue them 1 month of benefits and then get them an appointment properly scheduled out. Next slide. This is just showing kind of the amount of per clinic. So the top green line is our Altura office on 14th and Chambers. They're definitely our busiest office, followed by the other Aurora office in Aurora South. And then the green is Inglewood, and they just, we staff the offices based on the need. So Inglewood, small and mighty, but they are helping our other 2 Aurora offices multiple days a week, helping us try to get more clients on. So we definitely shift our staff around just to try to get as many people in as we can. And then the red line is the child health clinic, which we are only there about twice a week, but not even full days. So they also kind of use their days to help more Aurora clients as well. And then next slide. So this is just a breakdown of that 12,000 people, kind of who are they? So it is mostly children, because that's from 1 to 5, and then infants 0 to 1, followed by the breastfeeding women, pregnant and non-breastfeeding women. And next slide. So this is just showing the number of appointments we've had scheduled in January, just to kind of show the impact that we're having in that area. I guess I didn't mention in any of this that we are also with Village Exchange. It was once a month, and starting in April, we'll be there 3 times a month, co-locating, and we're there during their food pantry day. So I don't know if everyone's familiar. On Wednesdays, they have a very large food pantry. I think last week they said they served 900 individuals on that day. And so we are there with 2 of our staff, just enrolling families right there on the spot. So that's been pretty successful as well. And if you have a family interested in WIC, this website would help you show which office is closest to them, and then, just giving them a call. We have live receptionists at our 2 larger Aurora offices every day, all day. And for Inglewood, just being smaller, we kind of run more on like a voicemail situation. So sometimes someone will pick up, but typically clients will leave a voicemail and we'll call them back within 2 days. to get them their appointment scheduled as well. And on that, like, you can submit a referral on behalf of someone, or you can have the client just call us. That's honestly the best and fastest way. The referrals are pretty backlogged because we're like, let's just spend time seeing the people versus trying to get to the referrals. But we do, through Peak Pro, families can indicate, yes, I want to be on WIC. Then they'll get kind of flagged and put into our inbox. And our first kind of way to blast out is just to send all those people our phone number, give them a chance to give us a call. And then, we have been able to try to call them, but it's really hard to stay on top of that list while everything's been so crazy. And then just, yeah, my contact information as well. And if you have any questions, I was going to see one other thing I was going to mention is just that we do send out a monthly newsletter to our families that keep kind of nutrition and recipes, but then also like if there are any relevant community events happening or, with the earned income tax credits or things like that, then we'll add those into our monthly newsletter. So if people in this group ever want to have something they want us to add into our newsletter, we have a really great, like 80% open rate on our newsletter for our clients. So, yeah.
Thanks, Jaclyn.
Mm-hmm.
Great information. Questions? I know there were a few questions in the chat.
Okay. Have you noticed a trend, Jaclyn, with the change in like federal administration and people that may or may not have citizenship applying for WIC?
So, like our other programs in nursing have noticed a big kind of no-show rate, but we are not seeing that at all. I was telling people, I'm like, people need food, so I think they're gonna come. We don't check any status. We don't keep any of it on our computer. Like we don't have it anywhere. We don't ask. So WIC has always been like a trusted place for people, but I also think being remote, they probably feel a little bit more safe with that as well. So, they can fully get their benefits remotely. So I think that's helped us. We haven't seen a drop off at all like we were expecting to. When the public charge information came out years ago, like we did see a huge decline in that time. But right now, we really aren't. And I think that's a large part of our population. So far we are, yeah, still serving the people and they're okay to come. But like I said, the nursing programs are seeing a decrease. And I think, it's very important, but they need the food. So.
Oh, there we go. Is there capacity to monitor the electronic referrals?
So those, like the state kind of houses them and then they send them to us based on zip code. So our admin assistant, like I said, she'll send a blast email to everybody with our clinic phone numbers to say like, we will try to call you, but please call us first if you can. And then there's a way to kind of document in there, have you contacted them? Are they on WIC? All of that. And then if someone hasn't contacted us, we do have some staff time dedicated to contacting the referrals, but flu season, all these things, people are calling out sick. Like that's usually the first priority not to be taken care of, but we do try to get to it. And we're given, I think, 2 weeks to try to get to everybody. But really the fastest, easiest way would be for like clients to call us and get them scheduled.
I'm going to just give a little update. So there is another program that we wanted to let you know about. Our contact with Project Angel Heart was unable to join today, but gave me some information to share with you all. And it's called the Food is Medicine Colorado, or FIMCO. Another fun acronym, but it's a really interesting program. It's a statewide coalition that's aimed at enhancing the role of nutrition and health care and increasing access to medically tailored food and nutrition for folks living with or risk of severe, complex, and or chronic illnesses. And so there's a bunch of information that I have to share, but I wanted to just kind of give you the quick overview. The membership for the coalition is limited to community-based organizations that provide food as medicine interventions, which is medically tailored meals, groceries, and medical nutrition therapy. State agencies, regional accountable entities, so those are the organizations that oversee Medicaid in your region, and then hospitals and healthcare payers. There is a link here. Again, we will include all this information in our follow-up email, but this is just kind of basic information, but for others who may not fit within the membership designation or have different goals, we encourage them to consider connecting with one of the many other active food and health focused groups working in Colorado. So Aurora Health Alliance has partnered with the School of Public Health's Community Assessment Spring Semester class. And that project is focused on food security. And those students are working on both a qualitative and quantitative information around food, primarily in Aurora in the 800, 10, 11, and 12 zip codes. And so they are gathering data from different data points around food security, demographic data, geographic data connected with food and access to food, and then also conducting interviews. I think some of you folks on the call may have gotten some outreach from us and asking if you'd be interviewed by students. They're doing an awesome job. They've got an interview guide and everything. And so they are putting together this project, and then we'll have a final project presentation on May 7th. And you will be getting information about that and an invitation to come to the presentation either in person. They'd love to, it's a great opportunity for them to present in person, but there will be a virtual option as well. But we really encourage you to join and learn about what the students have learned from their data collection and interviews. So we're really excited to learn, just hear what they've learned from their work. And this is, if you're familiar, this is similar to the project we did with this class last year. They focused on housing and homelessness. So this year focused on food justice and food security. So we're really excited about that. So hopefully you can join the students, us and the students for the presentation on May 7th. It will be in the afternoon, probably around 3, and it will be on the campus, the Anschutz campus at their classroom. Thank you again, Leslie and Jaclyn, for all your information. Like I said, we'll share out the slides and any resources and links. All right, well, we'll wrap it up a few minutes early. Thanks everyone for being here. We look forward to seeing you at an upcoming Aurora Health Alliance meeting. So thank you all so much.